Welcome to Autism and Care, your trusted space for evidence-based insights, compassionate guidance, and real talk about autism. Whether you're a parent, caregiver, educator, or healthcare professional, this channel was created to support you with clarity, empathy, and accurate information. What is regressive autism and why should we talk about it? Did you know that roughly 20 to 30% of children on the autism spectrum experience what is known as regressive autism? This means that after appearing to develop typically, they suddenly begin to lose key skills they had already acquired. We're talking about things like eye contact, verbal communication, social engagement, even simple gestures like clapping or responding to their name. For families, this experience can feel deeply confusing and frightening. It often looks like the child is unlearning things they had previously mastered. Recent research shows this regression usually occurs between 18 and 24 months of age, a critical window for early childhood development. During this period, a child might stop using words, disengage from play, or lose interest in social interaction. Recognizing these signs early and intervening with the right support can truly change the trajectory of that child's development. If this message resonates with you, give this video a like and share it with someone who may need to hear it. The loss is real. Inside the brain's reorganization. What causes a typically developing child to lose previously acquired skills? One key explanation lies in a process called neural pruning. As the brain grows, it naturally strengthens neural connections that are frequently used and prunes away those that aren't. It's like decluttering to boost efficiency. But in some children, particularly those with regressive autism, this process may happen too quickly or in a disorganized way, affecting language, social behavior, and other core skills. Understanding this helps us see that regression isn't simply bad behavior or parenting mistakes. It's the result of complex neurological changes. If learning about the brain helps you better understand autism, subscribe and stay with us for more insights like this. How to recognize regression in a child. One of the toughest moments for any parent or caregiver is noticing that something feels different. Here are some early red flags that might point to regression. A loss of words or phrases the child used to say. A reduced or absent eye contact. A suddenly stopping pretending play, like feeding a doll or pretending to drive a car. Increased repetitive behaviors, such as rocking or hand flapping. A withdrawal from social interaction, even with close family members. Spotting these changes early and seeking professional guidance can make a real difference. Ideally, families should consult a multidisciplinary team for a full evaluation. Have you experienced something similar? Share in the comments. Your story could help another family feel less alone. Regression hurts, for the child and the family. When a child stops speaking, avoids eye contact, or no longer responds to touch, it's heartbreaking. For many families, regression triggers grief, guilt, fear, and a sense of deep helplessness. As the child withdraws, families often experience a kind of social isolation too. It's important to remember this is not your fault. Regressive autism is linked to neurological development, not to something you did or didn't do. What matters most now is compassion, accurate information, and professional support. If you're feeling alone in this process, please know you're not. Share this video with someone who may need support too. What causes regressive autism? A look into neurobiology. We don't yet have all the answers, but science is giving us clues. Along with irregular neural pruning, other factors can influence regression. Genetic predispositions, environmental stressors, or even medical events like infections. Children with a family history of neurodevelopmental conditions may have a higher risk. And while some cases coincide with stressful events or illnesses, there's one thing we can say with clarity. There is no scientific evidence linking vaccines to regressive autism. Spreading accurate information helps break down harmful myths. If you support science-based awareness, Leave a like to help amplify this message. How regressive autism differs from other types of autism. One of the first questions parents ask is, "Why now?" Or, "Was this always there and I just didn't notice?" In early onset autism, signs appear within the first months of life: lack of eye contact, limited social engagement, or no babbling. Parents often sense something's different, even if they can't pinpoint what it is. In regressive autism, which affects up to 30% of children on the spectrum, development initially appears typical: smiling, pointing, babbling, playing. Then suddenly, over weeks or months, those abilities begin to fade. It's often mistaken for trauma, behavior changes, or even disobedience. There are also children who show signs later, in what's sometimes called atypical or late-onset autism, where differences become clearer around ages 3 or 4. The key difference with regressive autism is that something is lost: a skill, a behavior, a spark. And for families, that sudden shift can feel devastating. But here's the truth: it's not your fault. Understanding the different autism profiles helps guide better support and lessens the burden of guilt. If this helped clarify your understanding, or if you've lived through a story like this, share your thoughts in the comments. You never know who might find comfort in your words. Treatment paths and support that make a difference. Getting a diagnosis of regressive autism can feel like the ground has shifted beneath your feet. But here's the good news: with the right interventions, there is a path forward. Early intervention is key. Research shows that starting therapy as soon as possible improves the chances of regaining lost skills and building new ones. It's not about curing autism, it's about empowering the child to thrive in their own way. Some of the most effective therapies include applied behavior analysis, ABA, evidence-based and structured, helping children learn positive behaviors and essential life skills. A speech and language therapy, crucial for rebuilding or developing communication, spoken or alternative methods. Occupational therapy with sensory integration, supports motor development, emotional regulation, and sensory processing. A psychological support for parents and caregivers, because your well-being is a vital part of the journey too. Each child is unique. Progress won't always be linear, and that's okay. What matters is a consistent, loving, and individualized approach. If you're navigating treatment options, reach out to professionals. And feel free to connect in the comments. There's wisdom and solidarity in this community. A message of hope: you're not alone. Talking about regressive autism means facing some hard truths, but it also means embracing the hope that still lives within every family. Losing skills doesn't mean losing your child. With time, support, and love, many children regain some abilities, build new ones, and continue to grow in ways that matter. Every child's path is different, and yours doesn't have to be walked alone. We've heard from so many families who found comfort through understanding, connection, and community. Whether it's a therapist who listens, a support group that understands, or a channel like this that shares truth with kindness, know that help is out there. You don't have to have it all figured out today. Just take the next step, and let love lead the way. If this video supported you in any way, please like it, share it with someone who might need it, and subscribe to Autism and Care for more compassionate, evidence-based content. It means the world, and it helps this message reach even more families who need it. See you in the next video where knowledge meets care, every single time.